I come from the emergency department. I'm all about practical. If it's not practical, it's not useful to me. And I've been able to really get behind the practicalness of this framework. So when we think about how we're going to improve safety in acute care and primary care in the post-acute setting, it's really complicated and there's tons and tons of projects. But the framework really breaks it out into 3 areas that are critical for improvement. So leadership surrounds the entire experience. If your leadership is not on board, you're not really going to make it particularly far. The other 2 pieces are the cultural domains and the learning system. And when we talk about the cultural domains, we're thinking about things like psychological safety. So are your team members able to share their concerns, in the units or at an organizational level? Accountability, things like just culture, which is a really hot topic in patient safety and something that's really difficult to put into place in an organization. Teamwork, that we've been working on for 20 years. And then this concept of negotiation, which sometimes sounds like it doesn't necessarily fit, but really it's about what matters. And so it's about what matters to the patient, what matters to the employee, what matters to the organization, and really asking that question in a way to make sure that you're building a sustainable safety system. The learning system also has some really interesting pieces. So transparency, about being transparent as an organization about what you're good at and what you're not so good at. Being transparent to your patients about what you're good at and what you're not so good at. The concept of reliability. So what are 5 things in your organization that must be reliable? 2 patient identifiers, or making sure people receive timely antibiotics in the OR. What does your organization want to get behind and make reliable? Improvement and measurement. Do you have a way to improve, like a real system? Are you using the model for improvement or Lean or DMAIC or Toyota production system? But do you have something? And are your frontline folks trained in how to improve any type of work that comes their way? And then continuous learning. How are you using things like patient safety reporting and root cause analysis and the employee satisfaction data and patient satisfaction data? How are you taking that and compiling it and moving your organization into a place where you are getting ideas for improvement, but also really building out some sustainable improvement. So I think the framework is very practical. It has some clear action steps in every part of the framework. And I'll just say it's not a short road. This is the marathon. This is probably the ultramarathon. But we know that there are health systems who have taken this on.